So this is a big, bold goal, health system that's net zero. In order for us to be net zero, we have to eliminate 3.6 million tons of carbon a year. That's a lot.
This is Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. Happy to be on the floor of health with David Callaway, the Chief Sustainability Officer at Advocate Health. David, good to see you.
Thanks, appreciate the time.
And you happen to be an emergency physician, which I love, worked with a lot of ER docs over the years. How does that shape how you have come to this role? I'm curious.
Yeah, no, I appreciate it. Well, my job has always been in crisis management and response, and so I spent 2 decades responding to extreme weather disasters around the world. And finally, my boss said, hey, should we take some proactive steps and start to manage this? And so he created the position, Chief Sustainability Officer. So now I work in the ER and I design the sustainability strategy for the nation's 3rd largest health system.
Okay. What is your primary sort of focus in 2024?
Yeah, in 2024, so Advocate Health now has gone through a couple mergers. We're building a new innovation district. And what we're looking to do in the sustainability space is map out partners who can help us get to our net zero goal. So this is a big, bold goal, health system that's net zero. And we need all of our innovation ecosystem driving towards it. So the people who make medical devices, our tech partners, our suppliers, the people who build our buildings, we're looking to engage and really push that forward.
Help educate us, help us know how big of a goal net zero is. Like, where are we at now?
Yeah, so net zero, in order for us to be net zero, we have to eliminate 3.6 million tons of carbon a year. Okay. That's a lot. Okay. And so we're shooting for 50% reduction by 2030, and then somewhere between 2035 and 2050 getting to net zero. That means our buildings, our hospitals, that means all the stuff we buy to take care of patients. And at the same time, we need to still make sure that we're providing even better healthcare to people as we do this.
What are some of the sustainability measures that are getting you most excited? What are you seeing in the market that you see as moving the needle?
Well, there are 2 things, and this is the paradox. So we're at the digital health mecca right now. So if you look at AI has the potential to fundamentally change the landscape by solving a lot of these problems. But we also have to solve this energy problem, because AI takes a ton of energy, and if we can't power it with clean energy, then we're really just going to be in a world of hurt. So the people that are all around here, all these like startups, we're looking at how do you come up with hyper efficient AI programs that will help drive innovation, cancer cures like the Cancer X program, the moonshots, and at the same time decrease the harm we're causing in the community because of pollution.
Is there a certain type of startup, more specifically, that you would love to have come pitch you?
Yeah, the startups that I want to hear from are people with bold ideas who really understand the link between climate, health, and technology. And when they're designing their tech, they're thinking about the impact that they're having on the planet, and then the impact that that's going to have on people, and then the sustainability of it. So does this tech last for 20 years, or are they going to run out of the material in 5? Like, we have to think through that. Because we're driving, again, for net zero healthcare.
Let's talk about the Innovation Center. I was just talking about with somebody else at Advocate. Seems like you're developing something really cool. Is it in Charleston?
Yeah, we're the Advocate Health Innovation District is called the Pearl. It's in Charlotte, North Carolina.
Okay.
Yep, it's a 30-acre innovation district. The anchor and the crown jewel is a net zero medical school and research building. So it's the first of its kind in the country. It's the first medical school that's going to be LEED zero carbon, which means once we turn it on, it can be net zero, all electric, hyper efficient, and that's really the flag we planted in the ground. And as we build this innovation ecosystem around it, it's focused on climate health and health equity. Okay. So we don't think you can have health equity if we don't address the climate change problem.
Okay. We work with a lot of founders. We work with the 500 startups over the course of 13 years at Startup Health. And I'm curious what advice you would give to an early stage founder who wants to be more sustainable, who wants to be a part of this sort of ecosystem approach, and yet maybe doesn't quite know where to start. Maybe they struggle to know what that first step is.
Yeah, I mean, the way I would lay it out is there's a tremendous problem, right? The World Economic Forum says climate change is one of the top global economic and social threats of the next 5 years, and the World Health Organization says it's the #1 public health threat of the 21st century. So if you're an entrepreneur, there's your problem statement. You've got this massive opportunity in front of you. The World Economic Forum also says there's $3 trillion out there in the circular economy. So if you can make products that are more circular, $3 trillion. That's big business. And if you look in the US, almost all the major health systems have committed to some sort of net zero or carbon reduction pledge. So you've got customers out there. They want these solutions. So go get it. This is a big, bold problem. It requires entrepreneurship, innovation. People are willing to take risks and to really go after it.
I'm curious about your role, because on one hand, you are dealing with these big, bold ideas, hey, net zero, 2030, 2040, and on the other end of the spectrum, you're going into an ER and you're taking care of somebody who has a migraine, like the problems at the most granular level, the most basic level, and I'm kind of curious how you marry the two. How do you bring some of these desires of sustainability into your work in the ER?
Look, at my core, I'm a doctor. I'm an ER doctor. I was in the emergency department at our level 1 trauma center until midnight last night.
Wow.
So I got 4 hours of sleep, caught a flight out here this morning. Last week, I was out in the mountains of western North Carolina responding to the hurricane. Wow. That's my core. So the ability to put hands on and help people is the core, and it drives all that I do. But you start to realize that there are these opportunities to impact and prevent people from getting sick. I mean, it's the basic injury prevention work that we've done with seatbelts and motor vehicle accidents, gun violence. We can make it so that people aren't as susceptible to these major disasters. We can make it so they don't get asthma exacerbations from air pollution, right? Like, I love making someone feel better, but I'd rather have that kid who's got asthma not get triggered because he lives next to a highway and is breathing in a bunch of air pollution.
Yeah, I love it. Well, David, thanks for taking this walk with me. It's exciting to see what Advocate's doing with the Innovation Center, with the Pearl, and with sustainability. So I appreciate all your work, and keep it up.
I appreciate the time.
All right, take care.
Thanks.